just within this short period of time where we had downpours and the light had to go off. A lot of you, or some of you I should say, were sending in messages that Doomsday is back and all of that. No, no, no. At least we've had the Ghana Grid Company clarify the position as regards what really happened today. But it brings back my mind to something. I will talk about what I witnessed today when I was on my way to the office, but it was something that KOJ also talked about this morning, and with regards to the doctor who passed on, because they are working 24 hours. And so these doctors at the various health facilities are working 24 hours to ensure that you and I are safe. Because of course, if you go to the health facilities and you don't get anyone to take care of you, you would complain. You go there at certain times and there's no one to take care of you, there's definitely going to be the complaints. But mind you, doctors are also human beings like you and I. And in a country where we're talking about where the doctor-patient ratio is nothing to write home about, you can understand that a lot of doctors will be attending to thousands of patients within a day. It's not an easy job. And so it brings back my mind to one thing, that look, you need to prioritize your health. And every day, Dr. Vanessa Pia gives us health tidbits right here on this program. It is important that you prioritize your health as a person, as an individual. You don't have to overwork. Sometimes you need to take a break and, get some time in the house with the family. It rests you, it gets you rejuvenated. It is important that you do that. But if we are talking about the doctor-patient ratio in this country, it is nothing to write home about. How are we going to ensure that the number of personnel or doctors we have in the country are able to match up to the number of the population even in itself? Because they fall sick and you would want to go to the hospital for doctors to attend to you. So it is important that we look at the larger picture in terms of how we are as a country we would be able to produce a number of doctors. But I should say, the problem really is not about the number of doctors that are coming out every day from the various tertiary institutions or medical institutions in the country. I have known a doctor who lived in this country for many years, many years, for close to 8 years, and his life was nothing to write home about. Because, look, it has become so difficult for them to get the jobs that they need. Some of them, of course, you would also want to post them, like we heard the health minister talk about recently, some of the postings that they made to some of the hinterlands or some of these rural deprived communities. And you would want to post them there so that they can go there and render their services. But those areas, in terms of the infrastructural development in those areas, there's nothing to write home about. And so it's really difficult for them to go there. Yes, of course, you have to offer to deliver your mandate to your nation, to your country. And so when you're posted there, it is the case that really you don't have to say anything. But the amenities and the infrastructural developments there are nothing to write home about. And so it gets difficult for people to actually get postings to these areas. But I'm saying that I've known a doctor in this country who has, since he was done with school, he had to stay in the house for some time, try to do his own stuff with some private facilities, elsewhere, and things were so difficult for him. So eventually, what did he do? He left the shores of this country to go and explore greener pastures elsewhere. So he's in the UK and he's living his best life. That's the truth. So you see, year in, year out, we produce a number of these professionals from our various tertiary institutions. And yet, we're talking about the fact that the doctor-patient ratio is nothing to write home about. I want to check that statistics and then I'll get you those details so that you get to know how serious an issue it is. Doctor-patient ratio in this country is nothing to write home about. And so we produce a lot of these doctors, but the facilities where they can go and work is not there. Yes, there are a number of facilities in this country, but I'm talking about at the government level, where government will make it a priority that we need to do something to step up the numbers in terms of the doctor-patient ratio in this country. That's what I'm talking about. There are a lot of private facilities in this country, but if that private facility does not employ you as a medical doctor straight from the medical school, or who has, and I'm sure you do something, I've forgotten the name, but it's something like into national service. So when you're done with it, you go through the process before you can start working. Of course, once you're even done with it, it gets difficult for actually you as a doctor in this country to get a good place to even work. Isn't it just like we, when we are all done with the universities and you have to undergo national service, you finish national service, you submit applications to, employers, and they tell you that the jobs are not there. And even if you get lucky and you are called and they interview you, they tell you that they need a certain number of experiences. So you are done with national service and you apply to a company, the company calls you, you go for the interview, or sometimes, if luck is not on your side, they don't even call you at all, because that 3 years, 4 years, 5 years minimum experience, you don't have it. You don't have it. So you stay home, and the question then is, who would give you that experience? Or which job would give you that experience for you to move elsewhere to also practice or use those experiences that you've gotten to practice at that company. No, it is not there like that. It has become so difficult. Getting jobs in this country have become so difficult. So when we are talking about doctors and what they are going through, these are the harsh realities. Working 24 hours in the country, like KOJ said, you work 24 hours. What time do you make to sleep? You need to prioritize your health. It is important to prioritize your health. Periodically, you want to go to the facility, the hospitals, to have yourself checked. And I'm not just talking about doctors only. I'm talking about the need for us as, people in the country to have ourselves checked periodically. So you're overworking, you're working all the time. Let me say, it's good morning here in Ghana, but I don't know what time it is in South Korea. But my brother Ibrahim is also listening inside South Korea. And of course, he was telling me that, look, Charles, back here in South Korea, it is the job availabilities are there. And so if you want to work 24 hours, it's up to you. Perhaps you know that you're coming from Ghana, and so you're in South Korea to work and get money and send back home and ensure that you put certain things in place before you even return back home. Before you realize, you'll be in a train going to work and you are dead in a train. No one, you would just be seated next to the next passenger, and that person wouldn't know you are dead. That person wouldn't know you are dead. So you see, the point is that we need to work. Yes, it is important that we work, but take time. Prioritize your health. Take time to rest. That is why in between time, companies have a policy that you can take some leave, and then you go home, and then you take a rest. Kwame Jumo told me something, that once you hit 40 years, and of course, all of you know Kwame Jumo, the host of this show, in whose capacity I'm sitting now, and definitely next week he's going to resume his duty. He told me that once you hit 40 years, see, Charles, you need to prioritize your health. He says that he goes for health checkup every 6 months. Every 6 months. So it means that, in between time, definitely there are times that you fall sick and you would want to go to the hospital and have yourself checked. But when you make it a deliberate policy to have yourself checked every 6 months or every period, you should set the period for yourself. Perhaps you want to do it quarterly. You want to do it, monthly or whatever. It is up to you. But you should be deliberate about having yourself checked and deliberate about ensuring that you are in the best health and, the best. Your health is in the best shape. That's what we're talking about this morning. So when Kyojo was talking about the fact that the doctor died and they work 24 hours, I have experience. I've had my own experiences at some of these government hospitals where one doctor, I see the doctor from morning to very late. You see the doctors from morning to very late. And I would say that the doctors and the health workers at the Ridge Hospital are doing some fantastic jobs. I say that because of some experiences I've had there. Regardless of whatever people say, the government institutions in the country, in as much as we have some people who are working there who are not doing stuff that you would expect them to do, I am telling you that we have a number of them who are doing so well. I recall when my sister was hospitalized at the Ridge, that's the Greater Accra Regional Hospital, and the kind of services rendered by these doctors. I've forgotten the name, but I think I can single him out. Dr. Julian, yes. Dr. Julian and co. And I'm mentioning your name here. I'm sure you are, if anybody is listening at Ridge Hospital, for instance, anybody who is closer to Dr. Julian can say that, or can let Dr. Julian know that there's somebody here in the studios of Class FM who is saying that he's appreciative of all the stuff that the doctors at Ridge Hospital are doing. A lot of them are working 24 hours. It's not easy.